In today's times, the success of modern medicine, especially neurosurgery, is hugely dependent on technology. Undoubtedly, North America has made groundbreaking progress in this discipline, all thanks to the invention and availability of the latest cutting-edge technology. These high-tech diagnostic solutions are redefining the way neurosurgery is performed, as they play a very important role in helping the surgeons achieve better precision to provide better outcomes. The Kokilaben Dhirubhai Ambani Hospital, located at Andheri, Mumbai, has brought together the latest technology from the West and the most talented doctors from the country to create a true world-class medical institution here in Mumbai. In 2009, a 3-room intraoperative magnetic resonance imaging suite, or IMRIS, was installed at the Kokilaben Dhirubhai Ambani Hospital.
The Kokilaben Dhirubhai Ambani Hospital would like to be recognized as a leader in patient care by bringing in cutting-edge technology which would aid our neurosurgeons in delivering superior quality of care and therefore superior outcomes.
IMRIS, the moving magnet solution at Kokilaben Dhirubhai Ambani Hospital, is the first in Asia Pacific apart from North America. Even Europe does not have this unique machine installation.
This is a 1.5 Tesla magnet which matches the strength of any diagnostic MRI available in any diagnostic suite. So there is no compromise in the quality of the MRI image which the surgeon is able to access during the surgery inside the operation theatre.
The first neurosurgical procedure performed using IMRIS here is for a young man who is a chemical engineer by profession. He suffered with uncontrolled epilepsy since childhood, and he underwent surgery using IMRIS successfully subsequently.
The IMRIS allows the surgeon to get real-time images of the brain before, during and after surgery, thus delivering greater precision and ensuring completeness in tumor or lesion removal.
The patient does not move, the patient remains in the exact same position as he is being operated on. And here the magnet moves to the patient, making it very safe for the patient without changing the anesthetic monitoring and the operating position for the patient.
While we are doing the surgery, after some time, after we open the skull and let out some fluid out, the pre-op scans will not be of use because of a phenomenon called as brain shift. IMRIS helps us in doing a scan intraoperatively and help us in the navigation. So in that way it is superior to the navigation already in use.
The IMRIS is one of the world's most patient-safe intraoperative imaging solutions with a 3-room design. It is basically a large magnet which is placed in a central diagnostic room with 2 adjacent operating theatres. During surgery, it can move into either of the operation theatres, allowing the doctors to perform 2 brain surgeries at the same time. Before the MR imaging, a checklist is made to ensure nothing metallic is present within the electromagnetic field of the IMRIS. The patient can be placed into the magnet anytime during the surgery.
No problem.
After the imaging, the magnet returns to its central diagnostic room And thereafter, both the operation theatres are just like normal operation theatres.
Without the intraoperative imaging, when we used to operate, at times we will not know whether we have removed the complete tumor, because in the brain sometimes it's very difficult to differentiate between normal and abnormal areas. Whereas if we have the intraoperative MRI, after the advent of this technology, we can precisely see how much of tumor is left behind or how much of tumor we have resected completely. So if there is a necessity to go back in again, it gives us an opportunity to do it in the same setting. Thereby this avoids a second operation and re-operations for residues for the patient.
IMBRIS is very useful in using resection of the low-grade gliomas, which is a type of intrinsic brain tumor. It can also be used in when we are excising the pituitary tumors, when you are excising the arteriovenous malformation, which is a vascular malformation of the brain. It can also be used in epilepsy surgery, head and neck surgery, and upper cervical spine surgery.
Advanced medical technology, like the IMBRIS, is one of the important pillars of the Kokilaben Dhirubhai Ambani Hospital.
IMBRIS Neuro is the most advanced neurosurgical imaging system on the market. The acquisition of this system by KDA Hospital in Mumbai is a strong statement about the value they put on providing the top world-class level of healthcare to the patients that they serve.
With a correct mix of talent, technology, infrastructure, and total commitment, the aim of this institution is clear: to build not just a hospital, but an organic entity which offers comprehensive healthcare services under one roof, creating a platform for transparent, patient-centric care, where every life matters.